All right, today we're diving into something that sounds like it's straight out of a sci-fi movie, but I promise you it is very, very real. We're talking about a hospital run completely by AI. Let's get into it. Okay, just picture this for a second. You're feeling under the weather. Instead of booking an appointment and sitting in a waiting room, you get an expert diagnosis, like instantly, right from your couch. Sounds like the future, right? Well, it's actually happening as we speak. And here it is. This is Agent Hospital. It's the world's very first virtual hospital, run, you guessed it, entirely by AI. What you're looking at is a completely simulated world where AI takes care of everything. So let's break down what Agent Hospital actually is. Think of it as a fully simulated hospital that lives in the cloud. It was developed by some brilliant researchers at Tsinghua University. And inside this virtual space, you've got AI agents playing the roles of doctors and nurses, handling the whole shebang, from diagnosis all the way to treatment. Okay, but the big question is, how on earth do you teach an algorithm to be a doctor? It's a fascinating process, so let's pull back the curtain and see exactly how these AIs are trained. So, get this. The virtual hospital is staffed by 14 specialized AI doctors and 4 AI nurses. And their textbook, it's a massive database with tens of thousands of simulated patient records. They're learning to treat everything from a simple flu to really complex respiratory diseases. This whole learning process has a cool name, Medagent Zero, and it's pretty wild. The system basically creates thousands of virtual patients with different ailments. Then the AI doctors and nurses get to work, diagnosing and treating them in this totally safe, simulated world. And the best part? With every single interaction, they get smarter, they adapt, and they get better at their jobs. You know, someone put it perfectly. They said it's like giving a medical student access to an infinite library of case studies, but with zero risk to any real people. It's just a genius way to learn on a scale that was never possible before. And when we say scale, we mean it. Agent Hospital can treat, get this, 10,000 virtual patients in just a couple of days. Now, to put that into perspective, a human doctor would need almost 2 years to see that many patients. That is just mind-blowing. But okay, speed is one thing. What about accuracy? Well, they put the AI to the test. It basically took the U.S. medical licensing exam for respiratory diseases, and it scored over 93% accuracy. So yeah, it's not just fast, it's incredibly effective. So we've established the tech is seriously impressive. But let's zoom out. What does this all actually mean for the future of healthcare? This is where it gets really interesting, because this could literally reshape the entire medical world. All right, let's do a quick side-by-side. You've got your traditional hospital on one side, physical buildings, limited staff, those dreaded long waits. And on the other, Agent Hospital, accessible from literally anywhere, 24/7, with zero wait time. I mean, just think about what a game changer this could be for people in rural areas, for elderly care, or for places where the healthcare system is just totally overwhelmed. But here's the thought. What if its most powerful role isn't actually about treating patients? What if its real superpower is something else entirely? The people who built it have this fantastic analogy. They call it a flight simulator for future doctors. And honestly, that idea might be just as revolutionary as the AI hospital itself. Think about it. In this virtual space, medical students can practice really tricky procedures over and over again. They can make mistakes, learn from them, and nobody gets hurt. It's the ultimate training ground to build up the skills and the confidence they're going to need when they're dealing with real people. Okay, so this all sounds amazing, almost too good to be true. But it brings up a really, really important question. What about the human element? What are the things that AI just can't replace? I mean, it really boils down to this, doesn't it? Can an algorithm show empathy? Can it truly understand what it's like to be scared, or hopeful, or to be grieving? Those feelings are so central to healing. Because at the end of the day, medicine is so much more than just data and diagnosis. It's about emotional intelligence. It's about making those gut-wrenching ethical calls. It's that intuition a seasoned doctor has. You know, it's about comforting a scared patient or helping a family through a tough time. And for now, at least, that's all uniquely human. And that's a really key point here. The creators of Agent Hospital are very clear. The goal is not to replace human doctors. Instead, the vision is for a partnership. Let the AI crunch the data, handle the routine stuff. That frees up our human doctors to focus on the things that matter most, solving the really complex cases, building trust with patients, and providing that irreplaceable human connection.
So, where does this all go from here? What's next on the horizon for Agent Hospital? Let's take a look at the road ahead. All right, so right now, Agent Hospital is in its pilot phase, being tested at a real hospital in Beijing. The next step is more testing, more refinement in real-world situations. But the long-term dream, the big vision, is for this to become a fundamental part of how everyone, everywhere, gets healthcare. And I want you to think about how big this could be. Remember how the internet completely changed how we communicate and get information? Well, Agent Hospital could spark a similar revolution for medicine. It could make healthcare accessible to anyone, anywhere, anytime. That's not just an improvement. That's a complete transformation.
It really is a bold, ambitious vision for what's next. A future where the incredible power of AI works hand in hand with the irreplaceable heart of human care.
So that leaves us with one final thought, and it's a question for you. Is this the future of your healthcare? When you think about it, what role would you want AI to play in your own medical journey?